Hi everyone, welcome back to FMG 2023 Jan Pharmacology MCQ Recall. Myself Padmanabha TS. So let us move on to what are all the questions that they have asked in your FMG 2023 Jan exam and let us find out the right answers. So coming to the first question, so they have asked regarding IVRA agent of choice. So, which of the following is most commonly used for intravenous regional anesthesia? So, the question was regarding the most commonly used drug for intravenous regional anesthesia. So most commonly used drug is the prilocaine, prilocaine, and alternative is the lignocaine. So let us see which are all the options for this question. So we have bupivacaine, levobupivacaine, lignocaine, and ropivacaine. So since prilocaine is not there in the option, so I need to go for the alternative drug, that is lignocaine. So here the answer will be your lignocaine. So the most commonly used intravenous regional anesthesia is lignocaine here. So next, coming to the second question. So which of the following antibiotic will be given in first 2 months of TB therapy? Or some of them said that the question was asked like this. So patient with history of cough for 2 months, and which of the following antibiotic will be used in first 2 months of therapy? So please remember, so in the first 2 months of therapy, you will be using the HRZE. So H stands for isoniazid, isoniazid, isoniazid. R stands for rifampicin, and Z stands for pyrazinamide, and the E stands for your ethambutol. So all of these are sidal in nature. Sidal. So isoniazid is sidal in nature, rifampicin is sidal in nature, pyrazinamide is sidal in nature, but ethambutol is static in nature. So here the answer will be your ethambutol. Ethambutol is the answer here. So streptomycin was the first IV drug which was used in the treatment of tuberculosis. Is that clear? Okay, fine. So next, moving on to the third question, that is a patient had a pain related to gout. So since the patient will be having increased uric acid accumulation in case of the gout, it will lead to crystal formation, which has led to the pain, and later it was subsided. And what will be given for excretion of the uric acid? So what are the drugs which can be given for excretion of the uric acid? So allopurinol and febuxostat are the xanthin oxidase inhibitor. They are the xanthin. They are the xanthin oxidase inhibitors. They are the xanthin oxidase inhibitors. They are usually used in the treatment of chronic gout. They are usually used in the treatment of chronic gout. So whereas colchicine is mainly used for the treatment of the acute gout. The probenecid is the uricosuric agent. So it increases the excretion of the uric acid. So here the answer will be, since they have asked about what will be the given drug that will increase the excretion of the uric acid. So your answer will be, it is your probenecid. Apart from probenecid, you also have got other uricosuric agents like benzbromarone, etc. So these are the xanthin oxidase inhibitors. So we have a allopurinol and febuxostat. Basically, they are used for the treatment of chronic gout. Please remember, it is used for the chronic gout. So allopurinol is a drug of choice. In case of chronic gout. So uricosuric drugs are the probenecid, benzbromarone, and sulfenpyrazone. So whenever we talk about the gout, so gout treatment can be classified into the acute gout and the chronic gout. In case of acute gout, the symptomatic treatment is given to relieve the pain. So we use non-steroidal anti-inflammatory drugs, steroids, and the colchicine. Whereas in case of the chronic gout, we use xanthine oxidase inhibitors like the Allopernol, fiboxostat, and we can increase the uric acid excretion by using uricosuric agent. And third group is the by increasing the uric acid metabolism like rasburicase, etc. Rasburicase, etc. So moving on to the fourth question, that is a female patient presented with pain, redness in the great toe, and serum uric acid levels were 9.6 milligram per dl, which is raised. Apart from prescribing the analgesic for relieving the pain, the physician prescribed a drug which can decrease the formation of the uric acid. So which of the following enzyme is likely to be inhibited by the following drug? So they are asking which of the following drug was prescribed to decrease the formation of uric acid. So please remember, to decrease the formation of uric acid, you use the Allopernol. So Allopernol is a xanthine oxidase inhibitor, which decreases the formation of the uric acid. So here the answer will be the physician has prescribed the Allopernol, which inhibit the xanthine oxidase inhibitor. Thereby it decreases the uric acid formation. Is that clear? Fine. So next question, coming to the fifth question, that is which of the following correctly describes the Dale's vasomotor reversal phenomenon? So what happens in case of the Dale's vasomotor reversal phenomenon is when we take the systolic blood pressure graph and the diastolic blood pressure graph. So this is the mean blood pressure. So if you give a epinephrine, what will happen? So there will be rise and fall in blood pressure. So this rise is mainly due to the alpha 1 stimulation, and this fall in blood pressure is due to the beta 2 receptor stimulation. So this leads to increase in the blood pressure, mainly increase in the systolic blood pressure, and this beta 2 stimulation will lead to decrease in the blood pressure, decrease in the diastolic blood pressure. So at lower concentration, beta 2 receptors will be more active. That's why you're going to see this phenomenon is also called as biphasic phenomenon. So what happens when Dale's vasomotor phenomenon? So if you give here the alpha blocker, so what will happen if you give epinephrine again? So you're not going to see only you'll see the exaggerated fall in the blood pressure. Only the beta 2 receptors will be sensitive, and thereby there will be decrease in the diastolic blood pressure, and you'll not see the rise in systolic blood pressure, since the alpha receptors are blocked. So this is the this is what happens in case of the Dale's vasomotor reversal phenomenon. So let us see the options. So they are asking about the correct description of the Dale's vasomotor reversal phenomenon. So the option A is repeated administration of ephedrine decreases its effects. So what happens in case of ephedrine? So if you are gone giving the ephedrine, so the responses will decrease. So this is called as the tachyphylaxis. So ephedrine when given continuously, it will going to cause a decrease in the response. This is called as the tachyphylaxis. Is that clear? Okay. So option A is ruled out. Excuse me. Sorry. Option A is ruled out. Excuse me. Option A is ruled out. And B, high dose of acetylcholine after pre-treatment with atropine produces increase in the blood pressure and heart rate. So it will produce, yes, due to the nicotinic receptor activation, it will going to produce the rise in blood pressure, but this is not a vasomotor reversal phenomenon. So increase in pulse pressure is produced by intravenous administration of the isoprenaline. Since it acts on the beta 1 receptor, it will increase the heart rate. So this is not the correct statement for Dale's vasomotor reversal phenomenon. So next is a patient pre-treated with phentolamine. So this phentolamine is a alpha blocker and develops a severe hypotension on administration of the adrenaline. See, here you are given a alpha blocker and you give a epinephrine here. So you are seeing the fall in the blood pressure. So here the pre-treatment with the phentolamine. Phentolamine is a alpha blocker. So this is the correct statement of the Dale's vasomotor reversal phenomenon. So which of the following correctly describe the Dale's vasomotor reversal phenomenon? The correct answer is a patient pre-treated with the phentolamine develops severe hypotension on administration of the adrenaline. So this is the right option. So coming to the sixth question. So some of them were telling that the oxytocin was asked. Oxytocin contraindication. So oxytocin is mainly used for the induction purpose, induction of the labor, induction of the abortion, etc. in case of uterine inertia. So they are totally contraindicated if there is any heart disease. In case of the heart disease, you need to avoid the use of the oxytocin. So what are the contraindications? The list of contraindications for use of oxytocin is if the cardiac condition, please avoid it. In case of grand multipara, if there is a scar due to hysterectomy, if there is a obstructed labor, if there is a fetal distress which is existing, and if there is a scar due to the uterine rupture. All these are the contraindications for the use of the oxytocin. So next, coming to the which of the following diuretic acts on the site. So this is the site they are asking. So usually, which is the drug which acts at this site? So this is the distal convoluted tubule. So this is the distal convoluted tubule. So which is the drug which is acting here? So it is your thiazide group of drugs. Which acts on the distal convoluted tubule. They basically inhibit the sodium chloride channels. So which is the thiazide example here in the option? So you have a hydrochlorothiazide. Hydrochlorothiazide is the thiazide which acts at the distal convoluted tubule and they inhibit the sodium chloride channels. If they had asked about this site, this one, so answer would have been the loop diuretics. Please remember loop diuretics. So furosemide, usually it is a loop diuretic. It will going to act on the ascending loop of Henle and it will going to inhibit the sodium potassium 2-chloride symport. So basically it will going to inhibit the sodium potassium 2-chloride symport. So what about the astazolamide? Astazolamide usually acts at this is the site where astazolamide will act. So astazolamide will act at the proximal convoluted tubule. They will going to inhibit the carbonic anhydrase enzyme activity. So what about the spironolactone? Spironolactone will act on the distal collecting duct where they are the aldosterone antagonist. Is that clear? Okay, fine. So next, coming to the 8th question, which of the following drug is used to decrease the progression of pulmonary fibrosis and increases the exercise capacity of the person? So here the answer is busulfane will going to cause pulmonary fibrosis. So you cannot use this. Here the answer is the perfenadone or the nintedanib. These are the anti-fibrotic drugs. Is that clear? Okay, fine. So basically, the roflumilast is used in the COPD treatment. Busulfan is used in the treatment of chronic myeloid leukemias, and bortezomib is used in the treatment of multiple myeloma, whereas nintedanib and the perfenadone is used in the idiopathic pulmonary fibrosis. They act as an antifibrotic agent. So coming to the drugs which are causing pulmonary fibrosis, you should remember. So please remember, bleomycin can lead to pulmonary fibrosis, busulfan, bromocriptine, gold, amiodarone, methotrexate and the cyclophosphamide can lead to lung fibrosis, pulmonary fibrosis. How to remember this in your exam? So please remember, pulmonary lung fibrosis means this is pulmonary fibrosis. P for P. You can remember P for P. That is perfenadone. Next, coming to the ninth question, that is identify the type of inhibition from the given graph. So this graph shows that, so this is the Vmax, and this will tell about the Km. So what is happening to Km? Km is same, and whereas Vmax is decreased. So this happens in case of non-competitive type of enzyme inhibition. Please remember, non-competitive type of enzyme inhibition. So here is the graph which you can differentiate between the competitive inhibition and the uncompetitive inhibition and the non-competitive type of inhibition. So in non-competitive, the Km is same, it is not affected, but the Vm is reduced. Whereas in case of non-competitive, see here, both the Km and the Vmax is reduced in case of uncompetitive inhibition. Whereas in case of the competitive inhibition, as you can see, here is there is increase in the Km. What happens to the Vmax? Vmax remains unaffected. So Km is increased and Vmax is unaffected. Then the graph will be the example for the competitive inhibition. So here the example for the type of inhibition for this graph is the non-competitive type of inhibition. So coming to the 10th question, that is which of the following drug decreases the cardiac remodeling and increase the longevity in chronic CHF? So please remember, the drugs which are decreasing the cardiac remodeling capacity are the ACE inhibitors, we have ARBs, we have aldosterone receptor antagonists like spironolactone, and we have ARNI, that is angiotensin receptor blocker, and neprilysin inhibitor, that is sacubitril. And apart from that, you also have got beta blockers, you have got hydralazine and isosorbide dinitrate. So here the option will be the metoprolol. Metoprolol is a beta blocker, which decreases the cardiac remodeling and increase the longevity. So the drugs that decreases the cardiac remodeling and increase longevity in case of chronic CHF is the AC inhibitors, angiotensin receptor blockers, aldosterone receptor antagonist, and angiotensin receptor blocker and neprilysin inhibitor, that is sacubitril combination, and we have a beta blocker. In addition to that, you should also remember the drugs like hydralazine and the isosorbide dinitrate. Next, we have a 11th question. Which of the following statement is correct regarding the mechanism of action of labetalol? So labetalol, please remember, labetalol is a third generation beta blocker, which has got both the alpha as well as beta blocking. In addition to alpha blocking, it also blocks the alpha activity. So which of the following is the correct answer? So beta blocker, it has got beta blocking activity as well as the alpha blocking activity. So image which is shown that is image based on renin inhibitor was asked. So if they are asked about renin, so you can remember this step. So angiotensinogen will be converted into angiotensin 1 and angiotensin 2. With the help of angiotensinogen to angiotensin 1 is with the help of the renin, and angiotensin 1 to 2 is with the help of the ACE enzyme, and we have, there will be release of the act on the angiotensin 1 receptor, as well as they release the aldosterone. So this will going to act on the blood vessel to cause increase in the blood pressure. Why there is increase in the blood pressure? Due to the vasoconstriction. So again, this aldosterone will retain the sodium and water, and this will lead to vasoconstriction, leading to increase in the blood pressure. So if they had asked about this site, then the answer will be direct renin inhibitor will be aliskiren. If they asked about this site, ACE inhibitor inhibiting this, then the answer will be all prils. That is the ACE inhibitors. ACE inhibitors end with pril. And if they asked about this site, then it would have been the ARBs. And if they asked about the release of renin from the JJ cells in the nephrons, then it would be beta blockers. To inhibit the release of renin from the JJ cells, then the answer would have been the beta blocker. Since they have asked about the renin inhibitors, then the answer will be the aliskiren here. So coming to the 13th MCQ, that is the 68-year-old male cancer patient on chemotherapy developed neutropenia. Which of the following drug is used to increase the immunity in this patient? They are asking, so which is the drug which is given to overcome the neutropenia? Again, it is a direct answer. So you are going to give a granulocyte colony stimulating factor. So the granulocyte colony stimulating factor will be your filgrastim. So filgrastim will be your answer. Oprelvecin is the interleukin 11 analog. Darbepoetin will increase the erythropoiesis. Romiplastin is mainly used to increase the platelet in case of the thrombocytopenia, etc. So please remember, filgrastim is used to stimulate the growth of WBC growth factor, that is a granulocyte colony stimulating factor, and oprelvecin is the interleukin 11 analog, and darbepoetin will increase the erythropoietin levels, and romiplastin will increase the platelet. So there was a question regarding dicumarol mechanism action. So what is the other name for dicumarol? Dicumarol is nothing but the warfarin, which is a orally available anticoagulant. So the mechanism of action will be it competitively inhibits the vitamin K dependent clotting factors. So this is the right answer here. If they asked about the mechanism of action, so you can select the competitive inhibitors of vitamin K dependent clotting factor 2, 7, 9, 10. So then 15th question was post-COVID patient developing tingling sensation. During the COVID-19, the patient or a person took excess of vitamin. What is the cause for tingling sensation? Again, a direct answer here. It is mainly due to the tingling sensation is mainly due to the vitamin D excess. That is hypervitaminosis. Hypervitaminosis is the answer here. So coming to the 16th question, that is regarding the potency efficacy comparison. So which of the following statement about the drug is false? So this will give the dose, this axis, x-axis, and the y-axis will give the response. So dose will tells you about the potency, and response will tell you about the efficacy. The height will tell you about the efficacy, and the distance which is moving from this center towards tells about the potency. And as the distance increases from the central point, the potency will going to decrease. As the height increases, the efficacy will increase. So this is the drug A, B, C and D. So let us see the options. So the drug C is less potent than drug B. So drug C is less potent than less potent than drug B. Yes, drug C is less potent than drug B. This is the right answer. This is the correct thing. So they are asking the false one. So drug B is more efficacious than the drug D. Yes, drug B is more efficacious than drug D. So height is more for drug B compared to drug D. So drug D is least potent. Drug D is least potent. Yes, it is the least potent one. It is the least potent one. Yes, drug A is more efficacious. So drug A cannot be more efficacious. Drug B and C is more efficacious than drug B. So this is the false statement. So this is the false statement, and this will be your option here. So coming to the 17th question, the antidote for iron toxicity in case of pediatric patient who has consumed the iron tablet. So here the direct answer question, the answer is the desferoxamine, which is given through the injection. Desferoxamine is a antidote of choice in case of iron toxicity. N-acetylcysteine is a drug of choice in case of paracetamol poisoning. And fomepizole is mainly used in case of methanol poisoning, ethylene glycol poisoning, and flumazenil is mainly used for benzodiazepine overdose. Whereas the other drugs which can be given in case of the iron toxicity, or which can be given in the form of oral route, is deferriprone and deferasirox. So deferriprone and deferasirox. So these are given through oral route, but whereas the desferoxamine is given through injectable route. So which of the following drug activates the paroxysmal proliferator activated receptor alpha? So again, these are the drugs which will going to act as a decreasing the cholesterol agent, that is the fibrates. Your fibrates will act by activating the PPAR alpha. So here the example for the fibrates is the gemfibrocil. Is that clear? So please remember, gemfibrocil belongs to fibrates. We have under fibrates we have fenofibrates, clofibrates, and the gemfibrocil. Here the right option is the gemfibrocil. Simvastatin is a HMG CoA reductase inhibitor. HMG CoA reductase inhibitor. Whereas alirocumab is the PCSK9 inhibitor. It also used to reduce the cholesterol levels. Then we have a cholesterol. Cholesterol is a bile acid binding resins. But here the correct answer is gemfibrocil fibrates, which will going to activate the PPAR alpha. So next, coming to the 22nd question, that is the best treatment of acromegaly with a history of acromegaly. So we can use somatostatin. Terlipressin is ruled out, is mainly used in case of the esophageal varices. Again, octreotide IV is used for the esophageal varices. But what they say in case of acromegaly, you can use the dopamine agonist like cabergoline. You can use bromocriptine. You can use growth hormone receptor antagonist, that is pegvisomant, and also you can use the somatostatin analogs like the octreotide and lanreotide, etc. This is longer acting, and again this lanreotide is the slow release preparations. So here the best option could be the lanreotide depot, because it releases the drug slowly and for a continuous period of time, for a longer duration compared to other group of drugs. So the appropriate and best possible correct answer for this question would be the lanreotide. So we have a cabergoline, bromocriptine, somatostatin analogs like octreotide, lanreotide, and pegvisomant, which is a growth hormone receptor antagonist. These are all used in the treatment of acromegaly. So coming to the 23rd MCQ, that was asked. So a patient of a colorectal cancer was treated with folinic acid and 5-fluorouracil irinotecan therapy. He developed the diarrhea following the regimen. So which of the following drug can be used for treatment of chemotherapy related diarrheas? So please remember, for chemotherapy related diarrheas, it is a non-infective diarrheas. It is a non-infective non-infective diarrheas. In non-infective diarrheas, the ideal drug would be the opioid group of drugs, that is the loperamide. So ciprofloxacin, metronidazole, they are mainly used for infective type of diarrheas, and these since loperamide has got less abuse potential, you need not give a atropine. So here the option will be the correct answer will be the loperamide. So next, coming to the 24th MCQ, that is a patient planned to receive a chemotherapy with cisplatin. Which of the following drugs are used for the treatment of the chemotherapy induced nausea and vomiting? They are asking about the chemotherapy induced nausea and vomiting. So here the best option will be doxylamine is used in case of pregnancy to treat the morning sickness. So here the better option will be the 5-HT3 antagonist. So let us see which are the 5-HT3 antagonist option is there. So we have granisetron here, again please remember, in case of chemotherapy induced nausea and vomiting, so we'll be better to use corticosteroids and the aprepitant. So the right option will be granisetron, dexamethasone and the aprepitant. So coming to the 25th question that was asked, a patient complains of ptosis, increasing muscle weakness by evening, and this weakness was relieved by neostigmine. So what is the likely diagnosis? So here the likely diagnosis, the muscle is improved after giving a neostigmine, which is an anticholinesterase. The direct answer you can choose here, it is the case of the myasthenia gravis. Next, coming to the 26th question, they asked regarding the therapeutic index formula. So please remember, if they ask anything about the therapeutic index formula, you need to remember the tile. That is, therapeutic index is nothing but the lethal dose in 50% divided by effective dose in 50%. It is a dose which is required to kill the 50% of the population. It is a dose which is required to be effective in the 50% of the population. So it is LD 50 by AD 50. So it is a measure of safety. So if they have asked about the statement like true statement, so that right statement would have been the dose that produces lethality in 50% by efficacy in 50%. So this will be the right answer. Lethal dose by the effective dose. The toxic dose will be in case of the animal studies. In case of the animal studies, you can use this. In case of human, it is LD 50 by the effective dose. So coming to the next question, that is, a given figure shows the effect of drug on blood pressure and heart rate. So drug is most likely to be whether it is epinephrine, norepinephrine, or the isoprenaline or the dopamine. So regarding the blood pressure, if you see these type of graphs, so and sorry. So usually what happens to the blood pressure when you give epinephrine? So when you give epinephrine, there is a biphasic phenomenon. So there is an increase in the systolic blood pressure. There is a decrease in the diastolic blood pressure. And what happens to the heart rate? Since epinephrine will also act on the beta 1, there will be increased. So what will happen is there will be increase in the systolic blood pressure, there will be decrease in the diastolic blood pressure, and there will be increase in the heart rate. So what happens when you give a drug with norepinephrine? So there will be increase in both the systolic blood pressure, there will be increase in the diastolic blood pressure, and also please remember, since there is a no beta activity, there will be reflex bradycardia. There will be reflex bradycardia. There will be decrease in the heart rate. So they say that this was a graph which was given. So there was an increase in the systolic blood pressure. There's an increase in the diastolic blood pressure. There was increase in the mean blood pressure, and also there is a decrease in the heart rate. There is a decrease in the heart rate. Then the correct option will be the norepinephrine. So sorry, this is norepinephrine. So what about isoprenaline? Again, it will going to increase the heart rate. Dopamine, again, it acts on beta 1 receptor, and again it will increase the heart rate. So only drug here which can decrease the heart rate will be your norepinephrine. So coming to the 28th MCQ, that is inhalation and induction of choice in case of pediatrics. So inhalational anesthetic agent for induction in case of pediatric is sevoflurane. Sevoflurane is a induction agent of choice in case of the pediatrics, please remember. So 29th MCQ was a 22-year-old female with bipolar disorder was on lithium therapy. Which of the following statement would about the therapy is not correct? They have asked about the not correct. So lithium decreases the thyroid function. This is the correct actually. Lithium will decrease the thyroid function. Lithium toxicity is enhanced by thiazide, since thiazide decreases the lithium excretion. Yes, this is the right statement. And hemodialysis is not useful in lithium overdose. So this is the wrong statement. So option C will be the right answer. Lithium is avoided in pregnancy due to thyroid. This is the correct statement. So which statement is not correct? That is the hemodialysis. Hemodialysis is allowed in case of the lithium. So hemodialysis is not useful in case of the lithium overdose will be the correct answer for this question. Next, coming to the 30th MCQ, that is a patient suffering from the depression has to be started on antidepressant drug. Which of the following is less likely to cause a sexual related side effect? Less likely to cause. So usually this venlafaxine, SNRI, this SSRI, and the tricyclic antidepressant, and this is a inhibitor reuptake. This inhibit the reuptake of noradrenaline and 5-HT as well as dopamine. So these drugs will have a sexual related side effects, and this will be relatively less with the Bipropion. So here the best option will be the Bipropion. So coming to 31st MCQ, some of them said that lithium mechanism was asked. So lithium, basically they are used in the bipolar disorders. It mainly reduces the glutamate activity, that is the excitatory ones. They increase the GABA activity, which are inhibitory neurotransmitters, and they are all GQ coupled mediated action, and also they decrease the dopamine. So if they are asked about anything related to drug, if you would have chosen these options for the lithium mechanism action, then you could have got the right answer. Next, coming to the 32nd MCQ, that is which among the following is most suitable for IV local anesthetics? So please remember, most suitable for IV local anesthetic will be your lignocaine, and bupivacaine has got the cardiotoxicity. Levobucaine is a congener of the bupivacaine, which is less cardiotoxic. So lignocaine can also be used in the treatment of ventricular arrhythmias. Coming to the 33rd MCQ, that is bladder carcinoma involving the bladder muscle. What will be the treatment? So here the best option will be the intravesical BCG. Intravesical BCG is used for the treatment of bladder carcinoma. So mitotan is used for medical adrenalectomy. Or in case of inoperable inoperable cases of adrenal cancers. So the right answer will be your BCG. So please remember, BCG is useful in case of as a intravesical therapy for superficial bladder cancers, and mitomycin is a alkylating agent. This can also be used intravesically to treat the superficial bladder cancers. And bladder cancer treatment of choice will be your gemcitabine and cisplatin, whereas mitotan is indicated mainly for a palliation of inoperable adrenocortical carcinoma, that is the adrenal tumors. So basically, mitotan is a drug of choice for medical adrenalectomy. So coming to the 34th MCQ, some of them said that the question was asked regarding related to the minimum alveolar concentration. So please remember, minimum alveolar concentration is related with the inhalational agents, inhalational anesthetic agent. So minimum alveolar concentration, how it is defined? It is the minimum concentration of inhalational agent that is required in the alveoli to produce the unresponsiveness to the skin stimuli in 50% of the patient. So it is a minimum alveolar inhalational agent that is required, that has to be present in the alveoli to produce the unresponsiveness in 50% of the patient following the skin incision. So basically it is the measure of the potency. Please remember, it is the measure of the potency. So MAC is inversely related to the potency. So greater the MAC, lesser the potency, and greater the MAC, lesser the potency, and if lesser the MAC, greater the potency. Is that clear? So till now we have discussed 34 MCQs which were asked in your Jan FMGE examination. Just let us again recapitulate it from the beginning. So here for this, the IVRA agent of choice is priloquine. The alternative will be lignocaine. The answer will be the lignocaine here. So here, which is the antibiotic which is given in the first 2 months of TB therapy? It is your ethambutol. You need to remember HRZD. Ethambutol is the correct answer. So for increasing the excretion of uric acid, you will give a uricosuric agent like proban acid. And next you have a drug which will decrease the formation of the uric acid. So that is the Allopernol, which inhibits the xanthine oxidase enzymes. So next is the correct statement regarding Dale's vasomotor reversal phenomenon. It is the option D, that is a patient pre-treated with the alpha blocker, that is phentolamine, develops a severe hypotension following administration of the adrenaline. So oxytocin is contraindicated in all the art-related conditions. They are contraindicated. So which of the following diuretic acts at this site? This is the thiazide. Thiazide diuretic will act at this site. And which will be the drug which will decrease the pulmonary fibrosis? P for P, that is the perfenadone. And we have identify the graph which has got this type of inhibition. This is the non-competitive type of inhibition where Km remains same and Vmax will decrease. And this is the different enzyme inhibition. One is the competitive, uncompetitive, and the non-competitive. And which of the following drug will reduce the cardiac remodeling, increase longevity? That is your propranolol. Here the option is propranolol is correct. And which of the following statement is correct regarding labetalol? Labetalol is third generation beta blocker which blocks both alpha as well as the beta receptors. So image shown in this is this site where it will going to directly inhibit the renin, that is the aliskiren. So in case of treating chemotherapy induced neutropenia, you're going to use colony stimulating factors like filgrastem. And dicumarol mechanism of action, that is warfarin mechanism of action, that is competitive inhibitor of the vitamin K dependent clotting factors. In post-COVID, tingling sensation was there following the excess intake of vitamin. So what was the cause for tingling? It is mainly due to the hypervitaminosis D. So then we have a potency comparison graph. So here the right answer is drug A is more efficacious. They are saying that drug A is more efficacious. Drug A is less efficacious compared to the drug B and drug C. This is the false statement. Antidote for iron toxicity, it is your desferoxamine. And which of the following drug activate PPAR alpha? That is a fibrates mechanism of action. Then we have a best treatment for acromegaly. The best option would have been here the lanreotide depot. And we have a cancer chemotherapy induced diarrhea, non-infective diarrhea. The drug of choice will be the loperamide. And chemotherapy with cisplatin, where there is a chemotherapy induced nausea and vomiting, the best option is the granisetron, dexamethasone, and the aprepitant. And next we have a ptosis, muscle weakness, which was improved on neostigmine. The diagnosis is myasthenia gravis. So regarding therapeutic index, you need to remember it is LD50 by ED50. It is a measure of safety. So which of the following drug will have a blood pressure and heart rate, which was given in the graph? So it is related to the norepinephrine. So anesthetic inhalation agent of choice in pediatrics is sevoflurane. And which of the following statement is not correct regarding lithium? Lithium, that is hemodialysis can be used in case of lithium. So the wrong statement here is that lithium is not useful in the lithium overdose. A patient suffering from depression, and which of the following less likely to cause sexual side effect? So less likely to cause sexual side effect is the Bipropion compared to other venlafaxine or the escitalopram or the imipramine will cause more of sexual related side effect. So lithium mechanism, if you were to see these anything on the option, you could have chosen this, and this could have been the right answer. It reduces the glutamate activity, it increases the GABA activity, it is GQ coupled mediated action, it decreases the dopamine, which is mainly used in the treatment of bipolar disorders. So which of the most drugs suitable for IV local anesthetic? That is the lignocaine. And bladder carcinoma involving muscle, the treatment will be the intravesical BCG, or if you have given mitomycin, you can choose mitomycin or gemcitabine or the cisplatin. Next you have a MAC, that is the MAC, which is a minimum concentration which has to be present in the alveoli to produce unresponsiveness to the skin incision in 50% of the patient. So basically it is a measure of potency and it is inversely proportional. The greater the MAC, the potency will decrease. So this was about the discussion on the maximum number of pharmacology recall from the FMGE Jan 2023. If you have any doubts with respect to any question or any options were altered, so please do comment in the comment box. We'll try to come out with the correct MCQ in the next video. Thank you.